Hi, I'm Jay McCallum with Core Balance Therapy, and last week we posted a video about the core and what the core is and why it's important. And we had some listener suggestions for other videos, and one request was that we talk a bit about good exercises for the knees and how we can do exercises to help build up and protect the knees. So I wanted to talk about that a bit today. The first point I wanted to touch on is to kind of address the idea of what we're trying to do with exercise. We obviously think of exercise as being a good way to build up muscles to protect a joint, and absolutely you can get muscles stronger and do that fairly rapidly with a good exercise program. But exercise is not just about building muscles. As you kind of stick with an exercise program and dose it well, you really have the potential to improve other structures. So tendons can become stronger and more robust with exercise, and the bones themselves can become stronger structures, and the ligaments around the joint strengthen up, and even the cartilage inside the joint has been shown to become healthier and more robust with a consistent exercise program. So it really isn't really so much about building muscles to protect the joint as it is building up the joint, building a stronger knee so that you can do more. So the other thing I always like to think about is, the best exercise program is the one that people will actually do. People don't have an easy time sticking with exercise. Life is full of lots of other things that demand our time and attention. So having an exercise program that you find gratifying, that's enjoyable, is really critical for long-term success, because it's the consistency with exercise that is so important to get its effects. So exercise that you enjoy, looking to build up the joints, the muscles, the ligaments, everything about it. So what would be some specific things that have some good evidence around them for knees? The two things that keep popping up in the literature are to strengthen up the quadriceps muscles, the muscles in the front of the thigh, and that probably also results in, like I said, kind of progressively loading the tendons in the front of the knee so that they become stronger and more tolerant of use. And then building up the muscles on the outside of the hip. And I want to kind of sidestep specific exercise, because exercise is really about where you're at, and an exercise program that's a great choice for one person might be just an awful choice for the next. But some classic ones that do often keep popping up are the simple weightlifting exercises. Things like squats and lunges are a great way to build leg strength. Also really like exercise for the outside of the hip in the form of single leg balance exercises, and variants on sort of side planking, which is a great way to challenge strength on the outside of the hip. All that said, while I prefer exercises that use the legs to move the body around, sometimes that's just not possible, or it's just not the right starting point for someone, and there is absolutely nothing wrong with a very simple side-lying leg lifts or knee extensions or exercises like that as a great starting point to start to move forward with an exercise program. So, as always, if you're thinking about an exercise program, or you've struggled to get going with an exercise program without having knee pain or some other condition, we're very happy to see you for that. Please give us a call. Thanks for listening, and we'll talk again next week.